If you're dealing with pain or dryness during sex, you need to hear this. I'm about to share treatments that work better than anything else for vaginal dryness. And it's probably not what you think. Stay with me because by the end of this video, you'll know exactly what to do to get relief. Hi guys, I'm Dr. Peter Aziz. I'm a board certified urogynecologist and pelvic surgeon. Today we're going to talk about something very important but rarely gets discussed, which is vaginal dryness. If you're experiencing discomfort, irritation, or pain during intercourse, you're not alone. Up to 50% of postmenopausal women, they deal with this issue. But it can happen at any age. So what are the good news? There are some effective and evidence-based treatments that are available for you. In this video, I'm going to be breaking down the best treatment options for vaginal dryness, from simple over-the-counter solution to prescription therapies. We'll cover what actually works, what the science says, and how to choose the right treatment for you. So let's get started. Before we talk about treatments, let's understand what's happening. What is vaginal dryness? This occurs when the tissue of the vagina doesn't produce enough moisture. The vaginal lining is normally kept moist by a thin layer of fluid, and that moisture is maintained by estrogen hormone, which keeps the vagina tissue healthy, thick, and elastic. So when the estrogen level drops, the vaginal tissue becomes thinner, drier, and less elastic. This condition is called vaginal atrophy of menopause. So what is the result? You may experience burning, itching, irritation, pain during sex, and even some urinary symptoms. So let's talk about the treatments. So treatment category number one, some non-hormonal moisturizers. That's the simplest option, the vaginal moisturizers. Those are non-hormonal, you can buy over the counter. They work by adding an extra layer of moisture to the vagina, and they are used regularly, typically 2 to 3 times per week, regardless of sexual activity. How to use them? Apply internally using the applicator, usually at bedtime, 2 to 3 times per week. Who should use them? Pretty much anyone with mild to moderate dryness, those who don't want hormones or they cannot tolerate hormones. Lubricants are different because they are used specifically when you have sexual intercourse to reduce the friction and discomfort. There are a lot of different kinds of lubricants. One of them is water-based. These are the most common ones and they are safe to use with condoms, like KY Jelly and Astroglide. They're easy to clean, but they may dry out during prolonged activity. Another kind is silicone-based lubricants. Those last longer than the water-based option and they feel more natural. They're also condom safe. Astroglide Gel and Uberlube, they're actually very good options. There are oil-based lubricants, that's coconut oil and other natural oils. They're also long-lasting, but you should not use those with latex condoms because they can break down the latex. So when those over-the-counter options don't help, now we get to talk about estrogen therapy. So estrogen is the gold standard treatment, specifically vaginal estrogen. This is a cream that you apply inside of the vagina. It's not an oral pill or hormonal replacement therapy that you would do. Because when you apply the estrogen locally in the vagina, it gets absorbed and it works better than when you take it by mouth. The estrogen, it restores the tissue in the vagina, makes it thicker, improves the blood supply, makes it better to produce natural moisture, improve healthy vaginal pH and the good bacteria. There are 3 main forms of estrogen. There is the cream. You apply that with an applicator. You can do that daily for 2 weeks and then you can space them out to 2 to 3 times per week. Some brand names like Premarin and Estrace. There are tablets that you can place inside of the vagina with an applicator, like Vagifem, for example. Same thing, you use it daily for 2 weeks, then 2 to 3 times per week. There is also an estrogen ring, which is a flexible ring that you place inside of the vagina and it releases continuous low dose estrogen. The research have shown that vaginal estrogen is highly effective for treating vaginal atrophy and dryness. It's considered safe for most women, even those who have a history of breast cancer, though you should discuss with your oncologist first. Also, one of the other benefits of vaginal estrogen that it can decrease the risk of UTIs. There is another treatment option, which is oral medications, or a medication called ospemifene. This is an oral medication that is FDA approved specifically for painful intercourse due to vaginal atrophy. It works on selective receptors. That means it stimulates estrogen in some tissues like the vagina, but it doesn't stimulate estrogen receptors in other places like the breast or the uterus. It's very simple. You take one pill daily by mouth, improves the vaginal tissue, moisture without need for vaginal application. Evidence showed that it can significantly reduce vaginal dryness. It's an effective alternative for women who prefer an oral medication or can't tolerate vaginal treatments. However, there are some important considerations. It can increase the risk of blood clots, and it should not be used by women with a history of stroke or blood clots or certain types of breast cancer. One of the common side effects would be hot flashes. Another treatment category is DHEA, vaginal suppository, which is there's a brand name called Intrarosa. It's a vaginal suppository. It contains DHEA or dihydroepiandrosterone. This is a hormone that it converts into both estrogen and testosterone in the vaginal tissue. How does it work? You put one suppository into the vagina at night before you go to sleep. It's converted locally to the active hormones that restore the vaginal tissue health. What makes it unique? Because it converts to hormones locally in the vagina. Same thing like the estrogen creams, the systemic absorption into your body is really low. So some of the other treatments that are out there are the energy-based therapies or lasers for vaginal rejuvenation. One kind of laser is the carbon dioxide laser. This uses basically carbon dioxide laser energy, and it stimulates collagen production in the vagina. There are some popular systems like the Mona Lisa and FemTouch. So these treatments work by triggering tissue regeneration, collagen production. The goal is to improve the tissue thickness, elasticity, and moisture. However, what we know, some studies showed improvement in vaginal dryness symptoms. However, the evidence is still evolving. The American College of OBGYN state that these treatments are still considered investigational. The reality is these procedures are expensive, typically not covered by insurance, and requires multiple sessions. While some women report benefit, we need more long-term data to support those. Lastly, we're going to talk about some lifestyle modifications, things that you can do by yourself. Don't underestimate those because they can have a huge impact. So one thing, try to stay sexually active as much as possible because regular sexual activity, that includes intercourse or self-stimulation, can actually increase the blood flow to the vagina and help maintain moisture. Try to avoid irritants like scented soaps, bubble bath, douches. They can disrupt the vaginal environment and can worsen dryness. Smoking can be very harmful because it decreases the blood flow to the vagina and can lower estrogen levels. Always stay hydrated, drink plenty of fluids, drink plenty of water because dehydration can affect all of the tissue in your body, including the vaginal tissue. So try to work with your doctor to find the right treatment for your individual situation. Remember, you deserve to feel comfortable and maintain a healthy sexual life at every stage in life. If you found this video helpful, please give it a thumbs up, subscribe to the channel for more evidence-based videos on female pelvic health, urology, healthy lifestyle. Drop a comment below if you have any questions or topics that you would like me to cover in future videos. Thanks for watching, and I'll see you in the next video.